In the emergency department, we're always trying to keep things moving, expedite the management. So sometimes we put orders in on patients that are still out in the waiting room just to keep things going. A few days ago, I had a 2-year-old boy that had right lower leg pain, and so I ordered the x-ray while he was still in the waiting room, and this is the x-ray that came up. And so he has a proximal tibial fracture. So this is the knee, this is the ankle. It's at the top part of the lower leg. I knew exactly what he was doing to sustain this fracture. So I gathered all the residents around and we talked about it, and nobody guessed right. This is a trampoline fracture. This happens very commonly in toddlers, especially when they're double bounced. We got him pulled back from the waiting room. He did get a dose of pain medicine out there, but he was still pretty uncomfortable. So I talked to parents about doing a nose spray pain medicine to help make him more comfortable, because we are gonna have to move the leg around a little bit to splint him. There's a lot of people that get nervous when I say the name of the nose spray medicine because of things they hear in the news and on the street. This medicine is called fentanyl. We use small weight-based dosing for kids, and we do monitor them closely while they have this medicine. It works very quickly, and it also wears off very quickly, which makes it nice for something like putting a splint on. He went from crying and super uncomfortable to way more like himself, and even cracked a smile while the splint was being put on. He's gonna wear the splint for a couple of days until he follows up with the bone doctor and get a cast put on, which he'll wear for a couple of weeks. This is a classic trampoline fracture that we generally would see in toddlers.